today we are going to see something about hyperkalemia. Hyperkalemia is the medical term that describes a potassium level in blood that is higher than normal. This mineral is classified as an electrolyte because it is highly reactive in water. When dissolved in water, it produces positively charged ions. Roughly 98% of the potassium in our body is found in our cells. Of this, 80% is found in muscle cells, while the other 20% can be found in bones, liver, and red blood cells. Blood potassium level is normally 3.6 to 5.2 millimoles per liter. The role of potassium in regulation of fluid balance. The body is made of approximately 60% of water. 40% of this water is found in intracellular fluid. The remainder is found in extracellular fluid. Potassium is the main electrolyte in the intracellular fluid, and it determines the amount of water inside the cells. On the other hand, sodium is the main electrolyte in the extracellular fluid, and it determines the amount of water outside the cells. How fluid and electrolyte balance is maintained with the help of potassium. Normally, there is an equal balance of electrolytes outside and inside the cells. This is called as osmolarity. However, when osmolarity is unequal, water from the side with fewer electrolytes will move into the side with more electrolytes to equalize electrolyte concentrations. This may cause cells to shrink as water moves out of them or swell up and burst as water moves into them. The role of potassium in nervous system. The nervous system relays messages between your brain and body. Nerve impulses are generated by sodium ions moving into the cells and potassium ions moving out of cells. This movement of ions changes the voltage of the cell, which activates a nerve impulse. Unfortunately, a drop in blood levels of potassium can affect the body's ability to generate a nerve impulse. Regulation of muscle and heart contractions. The nervous system is the one which helps to regulate the muscle contractions. However, altered potassium levels can affect nerve signals in the nervous system, weakening muscle contractions. When blood levels of mineral are too high, the heart may become dilated and flaccid. This can weaken its contractions and produce an abnormal heartbeat. In some cases, heart arrhythmia or an irregular heartbeat can be fatal and lead to sudden death. Other uses of potassium. A potassium-rich diet may reduce blood pressure by helping the body remove excess sodium. Actually, excess sodium results in high blood pressure. When this excess sodium is removed, the blood pressure will be normalized. Potassium-rich diet may help prevent osteoporosis by reducing how much calcium the body loses through urine. Osteoporosis is a disease condition where the bone calcium is lost. Here, if we take potassium-rich diet, the amount of calcium lost will be regulated. And another use is high potassium intake can help reduce water retention by increasing urine production and reducing sodium levels. Water retention can be prevented by intake of high potassium because high potassium reduces sodium levels. When the blood potassium level is high, the sodium will be excreted through the urine. The causes of hyperkalemia. The first and foremost cause is ineffective elimination, that is the decreased kidney function. Most of the electrolytes are lost through the kidney. When the function of the kidney is impaired, there is an imbalance between the production and the loss. So the amount of potassium start accumulating in the body, resulting in hyperkalemia. The next cause is excessive release from cells, like metabolic acidosis, insulin deficiency, beta blockers, and exercise. In metabolic acidosis, to normalize the pH of the body, potassium ions replaces the hydrogen ions by coming out of the cell. Thereby, blood level of potassium increases. Insulin is the hormone which helps the potassium to enter into the cell. When there is insulin deficiency, automatically this function is impaired and thereby the amount of potassium in blood level increases. The next is the beta blockers. Beta blockers blocks the beta adrenergic agents. These beta adrenergic agents are the one which help the potassium to enter into the cell. When this function is blocked, the blood level of potassium rises. Exercise. Normal exercise has nothing to do with potassium level, but excessive exercises causes tissue damage. Thereby, more amount of potassium is released into the blood. The last but not the least causes excessive intake of potassium through parenteral route. Though it is not the primary cause for hyperkalemia, parental administration of potassium causes drastic increase in potassium levels. Now let us see how the balance of potassium and sodium is maintained with the help of kidney. When the blood potassium level rises, blood sodium level falls. When this happens, the aldosterone is released from the adrenal cortex, which targets the kidneys. When the kidneys are targeted, potassium release is reduced and more amount of sodium is reabsorbed by the kidney. Thereby, blood and potassium levels are normalized. The signs and symptoms of hyperkalemia are muscular weakness, flaccid paralysis, paralytic ileus, ECG changes, nausea and vomiting, slow, weak or irregular pulse, sudden collapse because heart rate will become too slow or it stops, paresthesias, fatigue, palpitations, oliguria. Diagnosis of hyperkalemia is mainly done by serum potassium test, and because the heart functions are mainly affected by hyperkalemia, mostly people with hyperkalemia will be monitored through electrocardiogram. The main ECG variations of hyperkalemia are wide and flat P wave, prolonged PR interval, decreased R wave amplitude, widened QRS, depressed ST segment, tall and peaked T wave. Now we will see the changes in ECG according to the levels of potassium. The mild hyperkalemia, the serum potassium level will be between 5.5 to 6.5 milliequivalent per liter, and the ECG abnormalities are peaked T waves and prolonged PR interval. In moderate hyperkalemia, potassium level will be between 6.5 to 8 milliequivalent per liter, and the ECG abnormalities are loss of P waves, prolonged QRS complex, ST segment elevation, ectopic beats and escape rhythms. In severe hyperkalemia, the potassium level will be more than 8 milliequivalent per liter, and the ECG abnormalities are progressive widening of QRS complex, sine wave, ventricular fibrillation, asystole, axis deviations, bundle branch blocks and fascicular blocks. Medical management of hyperkalemia. The first and foremost drug of choice is calcium gluconate, 10 to 20 milliliters of 10% solution given IV over 2 to 3 minutes slowly. It can worsen digoxin toxicity. If the patient is taking digoxin, this can worsen the condition. And the next treatment is insulin, which is irregular. As we have seen before, insulin has a role in maintenance of potassium balance, where it helps the potassium to enter into the intracellular spaces. 10 units of insulin regular can be given IV with 50 ml of 50% dextrose. Next drug of choice is diuretics. Example, furosemide. The other name is Lasix, which is given 20 to 40 mg IV. It should be given with saline if volume depletion is a concern. This is effective only if adequate renal response is there for loop diuretic. In this, here, this drug helps excretion of potassium. And the other drug of choice is potassium binding resins like sodium polystyrene sulfonate, commonly known as K-exalate, which is given through oral route or as an enema. The nursing interventions for hyperkalemia. The main role of a nurse is to monitor cardiac, respiratory, neuromuscular, renal and gastrointestinal status. Stop IV potassium if running and hold any peroral potassium supplements. If hyperkalemia is noted immediately, the IV potassium should be stopped. Anticipate the need for dialysis if the patient doesn't respond to treatment. Most patients are renal patients who get dialysis regularly and will have high potassium. Initiate potassium restricted diet and remember foods that are high in potassium. Be alert for signs of hypokalemia after treatment. When hyperkalemia is treated, the patient may go for hypokalemia. The nurse should carefully monitor the signs of hypokalemia here. The potassium rich foods which has to be restricted are potatoes, pork, oranges, tomatoes, avocados, strawberries, spinach, fish, mushrooms and muskmelons. Also carrot and bananas. We can remember the word potassium for the potassium rich foods. Now we have come to the end of the portion. I would like to give you a few questions to test the knowledge which you have gained on hyperkalemia. Here is the first question. A patient has a potassium level of 8.9. Which nursing intervention is a priority? Prepare the patient for dialysis and place the patient on a cardiac monitor. Administer spironolactone. Place patient on a potassium restrictive diet. Administer a laxative. The correct answer is prepare the patient for dialysis and place the patient on a cardiac monitor. 8.9 level of potassium is very high. Here the patient is in a critical state and may go for a cardiac arrest. So the patient should be monitored on the cardiac monitor, and as an emergency treatment you can anticipate dialysis, so patient should be prepared for dialysis. The next question is, which patient will be at risk for hyperkalemia? Patient with Addison's disease, patient with parathyroid cancer, patient with Cushing's syndrome, patient with breast cancer. The answer is patient with Addison's disease will normally have hyperkalemia. The next question, which drug require the nurse to monitor the client for signs of hyperkalemia? Furosemide, metolazone, spironolactone, hydrochlorothiazide. The correct answer is C, spironolactone, because it is a potassium sparing diuretic. When the patient is on diuretic therapy, this will not cause the potassium to be excreted from the kidney. So this may result in higher level of potassium in the blood. The next question is, a client with potassium level of 5.5 milliequivalent per liter is to receive sodium polystyrene sulfonate or K-exalate orally. After administering the drug, the priority nursing action is to monitor urine output, blood pressure, bowel movements, ECG for tall peaked T waves. Correct answer is C, that is bowel movements. K-exalate causes potassium to be exchanged for sodium in the intestine and excreted through bowel movements. If client does not have stools, the drug cannot work properly. Blood pressure and urine output are not of primary importance. The nurse would already expect change